11% of people in the United States do not have health insurance. Due to the high costs, difficult transportation, and inconvenient timing, millions of Americans do not receive adequate medical care. Through the Gilmore Praxis Project, our group sought to discover the injustices of the healthcare system and develop new ways to solve them. Lack of access to quality healthcare is visible in all walks of life, but especially for the elderly and impoverished.
Our mission was to think globally and act locally. Through this motto, we initially researched the healthcare system in America as well as around the world. We learned about the injustices and difficulties people face in receiving the medical care they need. After analyzing this research, we took our global knowledge of the issue and applied it to the problems in the Cleveland area. Through the project, we became more aware of the injustices, analyzed their cause and effects, then took action on the injustice in our own community.
The first step of the Praxis cycle is awareness. In order to become more educated in the issue of lack of access to quality healthcare, we each conducted individual research. Some of the facts and statistics we discovered were truly shocking. It is important to realize that this issue is always developing. As new healthcare plans are proposed, new issues arise. Here are a few key problems facing the United States specifically. The first issue is the percentage of Americans who are uninsured. In recent years, the overall trend pointed towards progress in lowering the number of Americans without coverage. However, in 2017, the percent of those without coverage rose from 10.9 to 11.7 and is projected to continue to rise according to the Kaiser Family Foundation. Breaking down this 11.7%, we find that minorities are much more likely to go without insurance. Hispanics and African Americans see about a 17 and 12% uninsured rate respectively, compared to only about 7% of whites without coverage. It goes without saying that not having medical insurance can be a major hindrance to quality of life. In 2016, 1 in 5 uninsured adults went without necessary care because of the great cost of treatment. Without getting necessary care, life expectancy drops and families suffer.
This sudden shift in the trend could have been caused by the growing cost of insurance and medical treatment. According to the Tribune News Service, the cost of monthly insurance premiums and claims have nearly doubled since 2011. Along with that, the price for prescription drugs has continued to grow at a mind-boggling rate. Adjusted for inflation, the price per capita spending on prescription drugs over the years range. In 1990, $261. In 2000, $572. In 2010, $893. The prices just continue to rise. This isn't because medications are getting more expensive to produce. In fact, drug companies continue to find cheaper ways to make more effective medications. The pharmaceutical industry just continues to raise prices to maximize profit. And this practice is continuing to hurt millions of Americans who cannot afford their necessary medication.
After research and awareness, we connected back to Catholic social teachings and Holy Cross charisms. The teachings regarding rights and responsibilities tell us that we can only protect human dignity and a healthy community when we protect humans' rights, and we are responsible to do so. The opportunity to access quality healthcare is a basic human right, and therefore we are responsible to protect it. Additionally, the Catholic social teaching regarding option for the poor and vulnerable is important to our mission. The whole idea of social justice means justice for everyone, poor, rich, sick, healthy, fat, skinny, Muslim, Christian, gay, or straight. We are all made in God's image and likeness and thus connected by our human dignity. Furthermore, having already addressed Catholic social teachings as a driving force in our project, we then looked to the Holy Cross charisms. Option for the Poor and Zeal stuck out as important charisms to consider. As we delved further into the topic and considered actions, these charisms paired perfectly with our Catholic social teachings to provide motivation to move towards action. Option for the Poor, in terms of the charism, tells us to serve those in need because that is what Jesus did.
This takes our call to action further than just charity and turns it into service that benefits both us and the people we help. We aren't just giving to someone. We are acting like Jesus, and therefore through service we grow closer to Him. Secondly, zeal ties into the mission of Praxis because it tells us to make God known in the hearts of others. Zeal also helped to make this service project more than just charity. We grow in our own journey of faith and discipleship while we spread God's message to the hearts of those we serve. Our mission was to help create a more humane and just society by spreading awareness and compassion in order to help the victims of healthcare injustice to find access to programs or services that will benefit their health at an affordable and accessible manner. Although we may be unable to provide pro bono health services, by serving and spreading God's message to the patients and workers that deal with these injustices, we can guarantee that compassion and awareness follows. This is important because whether you are a heart surgeon or a high school student, you have the ability to extend your support and God's message to those in need. No matter what someone is going through, you can help ease some of that pain.
After research and analysis of the different causes for the lack of access to quality healthcare, we talked with professionals about their experiences. Through 3 different interviews, we learned that there are more barriers to healthcare than just having the ability to pay. Abby and Grace conducted the first interview with Kristen Morris, Chief Government and Community Relations Officer at the Cleveland Clinic. This was our first introduction to understanding that there are multiple different types of barriers that restrict patients from quality healthcare. Mrs. Morris discussed initiatives that the Cleveland Clinic is doing and planning to help reduce the number of those who are lacking healthcare. She mentioned that each area in need must be treated differently since the causes are different in each location. To our surprise, the 3 most at-risk areas in Cleveland are surrounding the Cleveland Clinic main campus, South Point, and Akron General Hospitals. Different outreach strategies include education on illness, investing in schools to teach about proper eating habits, and efforts to try to create a healthy culture in the community. Abby also went with Josie to interview Dr. Melissa Lee Ng, a staff physician and the current interim chair of the Endocrinology and Metabolism Institute at the Cleveland Clinic. She also worked as one of the first physicians at Cleveland Clinic Abu Dhabi before recently moving back to Cleveland. She, like Mrs. Morris, discussed that there are many different types of barriers that prevent access to healthcare.
What is really different is the barriers in other countries and cultures. She offered an interesting perspective on how social, religious, and governmental norms played into daily life while treating patients in Abu Dhabi. In the UAE, healthcare is mandated by the government but not subsidized, and health insurance is very cheap, unlike in America, where insurance rates continue to rise and where care at different hospitals can vary widely. Finally, a 3rd interview was conducted with Lisa Bartlett, a nurse practitioner in endocrinology at the Cleveland Clinic. She explained HCAP, or the Hospital Care Assurance Program, which is similar to a safety net and is built into a hospital's budget to help low-income families that cannot afford medical care. On the topic of finances, she also discussed how prescription drug prices are rising along with insurance rates, but despite how appealing universal healthcare may sound, it would be very difficult to implement since 1/6 of the American economy is in the healthcare field. Universal healthcare is active in countries like Canada, where everyone is covered under one plan, but she described how it would act like a band-aid. All 3 interviews expanded our horizons to realize that there are other barriers like transportation, socioeconomic status, the fear of illness, lack of illness education, and lack of access to preventative care.
After meeting with local agencies, our group wanted to take action to help those affected by the injustices of healthcare. For our service, we serve brunch at the Transplant House in Cleveland. The mission of the Transplant House is to provide affordable, temporary housing and a welcoming, supportive community to organ transplant patients and their families. After a doctor decides that a person needs an organ transplant, it can take several months or even years before that transplant is available. There are so many patients that need organ transplants, but so little available organs. On average, people wait for kidney transplants for 3 to 5 years, depending on blood type. To aid these people physically and emotionally, the Transplant House provides easy, affordable housing for patients and their families during the waiting period. As Dave from the Transplant House explained, this time in their lives can be just as hard on the family as it is on the patient. Along with a physical apartment, the Transplant House creates a supportive environment where people can tell their stories and hear the struggles of people who have been through the same situation.
By serving brunch, our group aided them physically, but more importantly, we were able to hear about their situations and become more aware. They were delighted that high schoolers would take the time to help them, and enjoyed hearing about our school, sports, and lives in general. Our service benefited the Cleveland area because it helped implant patients both physically and emotionally and allowed us to become more aware of their injustices. Our action was a form of charity because it aided those affected by the injustice, rather than attempting to attack the source of injustice. While charity is important, the best way to solve the issue of healthcare is through medical centers and legislation. By opening more healthcare centers, more people will be able to access their necessary medical needs. Also, hospitals and clinics need to create easier ways for patients to afford medical costs, receive proper prescriptions, and meet with doctors. In terms of legislation, the government needs to provide more healthcare assistance for the poor and elderly, along with making sure their money is being distributed sensibly.
Over the course of the semester, our praxis group examined the issue of inadequate healthcare. Most of us initially started the process thinking the only issue was health insurance, but quickly came to a realization that transportation, wrong ideas of health, time, and money all played a huge role in causing healthcare to be a growing issue. Ironically, some of those issues listed are being examined by other praxis groups. The interviews we conducted with Dr. Melissa Liang, Kristen Morris, and Lisa Bartlett enriched our understanding of the healthcare system and allowed us to dive deeper into the issues other than insurance. We learned how there are many ways to avoid the issues with healthcare, but how many areas are unavoidable. It was extremely shocking for us to see how the lack of access to quality healthcare was happening right in front of us at local hospitals, and we weren't even aware or concerned before the process of praxis took place. During our action response at the transplant house, we were able to get a first-hand experience with those dealing with the healthcare system. While talking with people waiting for lungs, intestines, hearts, and livers, we were able to see how much of a toll health issues can have on one and their family. The people we met with were from all over the country and were staying in the transplant house due to the affordability it offers for families. Most of these family members have jobs back at home and come to Cleveland every weekend in order to support their family members who are awaiting a transplant.
The transplant house inspired our group in the sense that these people are taking action to help those dealing with the healthcare system. They realize that these people are struggling enough already, knowing every day that their life is at risk, and they want to provide some sense of comfort by providing them with an affordable apartment to stay within a great location that is within minutes of the hospital, while also allowing them to meet members of the community who want to hear their stories and share them with the world, just like our praxis group did. The next step that we have to take is continuing to share their stories and exposing the wrongs of healthcare that happen right in our community. By sharing these people's stories, we can bring awareness, which will hopefully light a spark in people to volunteer, to serve meals at the transplant house, and to provide transportation for those that need it. Access to healthcare can be the defining factor in a life or death situation, and we need to help all of our brothers and sisters to ensure that everybody has proper access to healthcare. Furthermore, spreading a call to service is important because there are still people that face these injustices. Our support and service spreads hope through God's message while easing the stresses of the process. Through service, we even provide ourselves with an opportunity to grow in our own relationship with God.